네, 이번 순서는 자살 예방 토크 콘서트입니다.
This is a talk concert to prevent suicide. We are privileged to have Mr. Ki Sun-wan, Chairman of Korea Association for Suicide Prevention.
진행 부탁드립니다.
Please introduce the speakers and discussants.
가톨릭 관동대학교 정신건강
I'm Ki Sun-wan, Chairman of Korea Association for Suicide Prevention, also the professor at Catholic University. I am happy to have discussants. Professor Baek Jong-woo, head of the Korea Suicide Prevention Center. We have Mr. Seo Il-hwan, Director of Suicide Prevention of Ministry of Health and Welfare. He has been involved in many projects in the Citizens Coalition for Safety, Professor Yang Do-seok of Gachon University. And also we have Chairman Jang Eun-jin of Korea Psychology Association. We are also privileged to have Danish discussants. They are on ready.
Speakers are ready to participate in this discussion with us. Are you ready?
Yes.
Yeah. 그래서 먼저 두 분.
So now I'd like to ask questions to two Danish speakers first, and we will listen to their say and then continue our discussion. We are going to start by talking about status, and then we will interpret the status, how we're going to predict from the statistics, and how we're going to come up with the solutions. So, I'd like to welcome Dr. Merte Nordentoft. She's a professor of Mental Health Center, Copenhagen. Since this pandemic, there are many issues that we have to fight for. But for suicide prevention, if you can prioritize, what are the key areas that we have to focus? Can you please share one or two?
Thank you for inviting. My name is Merete Nordentoft. I'm professor in psychiatry, and I've worked with suicide prevention in Denmark for many years. And if I am to think of priorities, I think the most important issue is to ensure efficient help to people with suicidal thoughts and suicide attempts, and sufficient follow-up. So I would focus mainly on that. Of course, there are many initiatives that I've also explained in my presentation, but if you are to prioritize, I think the key issue is to make sure that people who are in the suicidal process, considering having suicidal impulses or suicidal thoughts and maybe planning a suicide attempt, that they know where to go and that there are competent people who can take care of them and make a continuous plan for their care, so that it's not just like you go to an emergency room and somebody conclude that, okay, it's not that bad, but that you actually take it seriously and follow up on those events.
예. 아무래도 덴마크가 그
Yes, because Denmark is very famous for providing support for people who are feeling attempts or feeling tempted to commit suicide. So that was a very useful strategy. And second, to Dr. Thomas Saxild, the question goes to him.
When it comes to suicide prevention, what is the role of doctor? What is the role of medical doctor to prevent suicide? What do you think are the roles in preventing suicide, especially in the pandemic situation? There are many roles in doctor, but can you please specifically tell me about the suicidal prevention?
Well, the question was for me. Sorry. Yes. Well, as Merete Nordentoft described, we have organized our health system. So every people knows where to go if they feel sick in any way. So we have the family doctors. So it's pretty much the organization of a health system. I think that's is our strength. So we, even though there's this pandemic situation, I think people still knows where to go. So it's not an obstacle for them to go to the family doctors when they feel psychological bad or sick or have suicidal thoughts. So they'll come to us.
Yeah, yeah.
Yes, because in Europe, these family doctors are working on preventive measures, and in the psychiatric area, they are focusing on the secondary medical services. So, and they are playing such important roles. And I would like to say thank you to two doctors for taking their time to be with us.
So much.
Thank you.
예, 그러면 이제
Now we will begin another session of discussion. So I would like to ask Professor Beck Jong-woo about the current status related to suicide cases. But after the COVID-19 outbreak, what characteristics of suicide case can be found? So what do you think is the characteristics or special or something different after the outbreak of COVID-19? Yes, as you may well know, through the available data as of 2020, you can see that the suicide cases have dropped in general terms, but it went down during this year. But the number went down for men, but the number went up for women. And according to the Statistics Agency, 7.1% for women cases went up by 7.1%. So as I have mentioned during my presentation, the UN policy brief also mentions the possibility of a bigger impact for women because of this COVID-19 outbreak, because women may feel more financial difficulties from this era. After the outbreak of COVID-19, I believe that many things have changed, but one of them is that the number for women suicide cases went up because they are more women are working on service sectors on an irregular basis. So they are working on contracts. And they also have to take the responsibility of taking care of their children because children are not going to schools during this era. So all those factors, I believe, have led to the increased number of women suicide cases. But at the same time, the high rate of suicide among the elderly people and the high figures are seen among middle-aged men. So such situations are still the same. Given all those factors, Professor Park, what do you think we have to think about and what we have to plan for the future? Because this COVID-19 era is being prolonged, so one of the major reasons for suicide is economic difficulties. So living alone, elderly people or the vulnerable people, they are going through such huge agonies and difficulties. And more women are suffering from reduced income, and some of them are not getting any income, so they feel depressed and then they end up with taking their own lives. So when people get together and socialize all together and they go some religious activities, that could reduce that depression. But now people are not able to do all of them, and this is leading to more suicide cases. So I think the Korean government was acknowledged for its excellent work on preventing further spread of COVID-19 viruses. But during this 10-month of period, every day they announced the situation related to COVID-19, but they did not mention any countermeasures or any situation about people who are suffering from depression or attempts for suicide. And I am so concerned that more people will go through more difficulties. So we have to identify people who are at a higher risk of suicide. And as Professor mentioned, we implemented a so-called 3T strategy for COVID-19. And as we did that for COVID-19, we also have to do the same kind of effort to reduce the suicide cases. And that is the role that the government or the communities have to play. Yes, we have vulnerable groups of people, and many people are suffering from losing jobs and any other financial problems as well. So yes, we have to come up with strategies for those people. Now, I would like to ask some more questions to Danish doctors. Yes, first to Professor Merete Nordentoft.
On suicidal rate, considering COVID-19 pandemic, for example, sudden high rate of suicidal rate in a specific age population, for example, or something.
Could you repeat the question?
Yeah. Would you please explain any kind of specific trend or specific change on suicide rate in Danish population or European population? Okay.
Yeah, I'm afraid from a Danish experience, we haven't got the answers yet regarding what has happened to suicide trends during the pandemic. And I know from different European countries there's been very contradictory findings. What we have done in Denmark during the pandemic is that we've made sure that it's still possible to get help. And people are encouraged to seek help for mental health problem, even during the pandemic. For instance, for the general practitioner, for the psychiatric emergency rooms, and also the psychiatric clinics. All these clinics have experienced fewer calls, at least temporarily. And I think it was because the users were so afraid that there was not any time left for the staff to take care of them. But now it's up at a usual level, and we have seen the usual number of referrals to suicide prevention clinic and also to Lifeline.
Okay, thank you. 예, 지금 번역을 해서 아마 다 들으셨을 거로 생각하고요. 뭐 유럽이나 덴마크도 아직 뭐 확실히
Yes, in Europe and in Denmark as well, they haven't got any specific results, yes, related to such trend. This question goes to President of Korean Psychological Association. Related to mental diseases or related to financial problems. So I think people are connecting the COVID-19 pandemic with economic or financial difficulties, but what about the mental or psychiatric characteristics? So people who have any certain tendency would commit more suicide or something like that. So what characteristics define a more likelihood of committing suicide?
As Chair just mentioned, that one of the biggest problems in Korea is that psychiatric issues. OECD mentioned in 2013 that the Koreans need to improve mental status. That is not only for severe people, but also people with minor or mild issues. So the OECD mentioned the UK example. As the chair just mentioned, that in our lifetime that we experience difficulties, sometimes that can lead to mental illnesses. Of course, we need to get treatment for that, but that we are easily been put in difficulties. So we need to have psychological resilience. So psychological resilience is very important. Sometimes you get involved in conflicts with your couple, with your partner, and the uncertainty brought by the pandemic. So if I can go back to the question, I'd like to nail down the resilience, psychological resilience, and people who don't have enough resilience will be easily influenced by lifetime difficulties, and especially people with existing symptoms or existing problems are vulnerable to this difficulty, pandemic. What is really unfortunate in Korea is that there are good medical services that we provide, especially to deal with COVID-19, and also we have good welfare system. However, as OECD mentioned earlier, that there is no psychological or psychiatric services, and also we don't have enough expertise in those who provide this kind of services. So in terms of psychiatric issues, that we need to implement faceted approaches. Right, so she mentioned that the people who have less resilience and the people who experience extreme difficulties in the past will go through more psychiatric or mental issues. And also people who have mild mental issues need support, consultation support, and we desperately need that kind of wide range support. And that leads to the budget issue that we have National Health Agency in Korea, and then that is involved with the payment and budget issues. So it's really difficult to just spread that kind of service to the nation. But she mentioned that the self-clinic to support people who are not severely going through psychological issues, but people who are under stress, they need to casually go and get that kind of service. Right, so thank you for your answer. And now I'd like to ask Director Seo, what are the policy interests? What kind of targeted groups are you focusing on at the moment? And what are the responses of the nation, of the government? Thank you for your presentation. I don't know if I have understood correctly, but from what I've heard from you and the things that I have considered so far that I'm going to wrap up. Last year and this year that we have slightly uptrend in terms of suicidal rate. So the government has come to realization that we need to pay extra effort to contain the suicide issues. So there are three causes: psychological issue, the economic issues, and the physical health issues. And these are the main causes of the suicide. And I'm sure that you have agreed to these three issues. Then if these kind of fundamental issues are degraded, then the people will go into the upper level of severity in terms of psychiatric issues. So each stage needs to get support. So fundamentally, that we need to enhance economic status, like policy. And you mentioned about national health insurance, and also we need to support through employment support. So we need to combine all the related policies to make our system better as a whole. And the Ministry of Health has a person in charge of psychiatric mental health. So these managers are responsible for enhancing the mental status of the public. But the task I'm responsible, and I believe it's important, is for the people who are in the severe status. According to the researches which have been conducted so far, who attempted suicide, there is a high chance, 20 or 30 times of trying suicide again. And especially bereaved families who have a family member who committed suicide and died, they also have 8 to 9 times of suicide try. So if we can at least focus on these high-risk people, that we can save precious lives. So these are two areas that I am focusing on. We are working hard to strengthen the monitoring system for these two risky groups. As Director Seo just mentioned, that it is clear that bereaved families should receive treatment. And I believe that Denmark is doing well in terms of treating bereaved families. So please refer to the cases of Denmark cases, and please make sure that you better take care of these people.
Now I would like to talk about countermeasures. As we have seen during the K quarantine system, I think we have to come up with new approaches, and we need to collect all kinds of data and identify patients or people with some problems proactively, and we should be careful not to harm their self-esteem or personal sentiment, but still we have to provide support in advance, and by doing so we will be able to take our nation to the next level in terms of preventing suicide. And to do so, we will have to develop human resources and get more financial support. and develop a community outreach system. So all these kinds of proactive systems should be developed, and I think all other experts will agree with my views. Please, Professor Beck, what are your thoughts on this? Yes, I worked with Citizens Coalition for Safety, and we made a visit to Denmark. And what was really surprising for us was that more than 90% of medical services were being provided by public services. And as Doctor has mentioned, they are running clinics. And there are officials who are responsible for this particular matter. And through a municipal election, they actually elect those people who are responsible for taking care of this matter. So it was so impressive. And the family doctor system in Denmark has been around for more than 2 decades because they are taking care of families for a long time. They get trust from people, and by doing so, they are doing a very good job. And I am certainly with you that we have to learn from Denmark, and we have to be very efficient in employing human resources and financial resources as well. But if we could make some modifications or make changes in the legislation of South Korea, we will be able to get more trust from the public. And for example, we will be able to use AI technology to identify high risk groups of people, and they are marked differently on the record. So by connecting all different resources available to us, we have to make use of Korea's strong points such as IT technology, or being very swift in taking some measures or taking actions. So the National Assembly has a role to play in collecting people's opinion and then provide support in advance before people who are in need of help actually request or ask for that help. So we need consensus or agreement from the National Assembly, and then between medical agencies and welfare agencies, they have to share data, and in that way we will be able to identify people at risk more quickly. So if we could collaborate that way, I think we will be able to catch up with Denmark more quickly.
Professor Yang, any good ideas, please? On top of that, I feel devastated to see that the 38 people are losing themselves, losing their lives. So if the government doesn't work harder, then who can save them? Well, the Moon administration said that they're going to reduce 50%, but it's actually increasing. this is a national crisis. To reduce suicidal rate, we need to learn from overseas. The Prime Minister is responsible in Australia, and the high-ranking officials are working hard to prevent suicide. I know this current administration has created this issue, the policies for this issue, but this is too minor. In the 1990s, we had notorious rate of traffic accidents and traffic deaths. However, that we managed to control them as we had a group under the presidential office. So we need to have suicide prevention office under president, and all the relevant ministries have put all their efforts and might. Compared to Japan's budget, that it's very minor, and we have learned from Australian cases that, their numbers compared to us, their number is phenomenal. So as our budget is so limited, our professionals are not professional, that they are irregular workers, and they don't have sense of responsibility. So we need to form a proper organization, and we need to drastically increase the budget. And many speakers mentioned about the tool. We need to regulate the tool. In Denmark, they have caught the tools that can cause suicide. We're doing it in the subway, that we have installed the screens to prevent people from jumping into the railroad. So also that we have to do some more to prevent people from jumping from the bridge, and any like stove or the things that can prevent suicide prevention. And one of the important roles of media is that they are too much excited about reporting the celebrities' suicide. Even teenagers, when they hear that their favorite celebrities kill themselves, then the teenagers are easily influenced. But we're too commercially concentrated on dealing suicide-related news. So the government, the local government, and the religious groups and the media, we have to think suicide as a very big issue, and we need to pull our effort and wisdom together to prevent suicide. Right. Thank you very much for your sincere remarks. Right. So the media and the local government and the public, we need to think suicide prevention as a national agenda. So we have to pull our might together. And he emphasized increasing the budget. Suicide is something caused by various mixed issues. It can cause by personal financial difficulty and also personal level of resilience. So if we go into deeper the suicide issues, that we can also excavate the deep-rooted problems of the society. Of course, we have to reduce the number of suicide rates, but at the same time, by working on these key issues, that we can have the newborn country. So to make that happen, we need to cultivate professionals who can provide professional consultations. Then we need to develop good programs. So in that end, the chairman of Korean Psychology Association has, please give us good remarks.
What is different now from before COVID-19 is that we are doing non-face-to-face consultation. It is happening in the US as well. So International Psychiatric Association is also doing this. So in the UK and in the US as well, they have prepared the guidelines for such non-face-to-face consultation services for people who are suffering from mental diseases. And I think South Korea also has to take that into our system. Not only just a public sector, I think we need collaboration from the private sector as well. Because I am president of Korean Psychological Association, I feel huge responsibilities on my shoulders. During this COVID-19 era, we are getting so many calls from people who are feeling depressed, and many of them are feeling tempted to commit suicide. So we are preparing some guidelines to deal with those cases, and we have some expertise who have master's degree in this related field. Actually, I want to ask a question to professors from Denmark. Is it okay if I may have? What was very interesting to me was that because I am psychiatrist as well, Professor Merete Nordendoft in 1977 to 2011, you mentioned physical and restriction on methods, and also you also mentioned psychosocial intervention. So you mentioned those two factors. Then in Denmark, psychologists. What is unfortunate is that in South Korea we do not have a licensed psychologist system. But what do you think experts like me could do to prevent suicides? And you also mentioned universal, selected and indicated preventions. And among those three, which one should be done by psychologists like me?
Thank you for the question. Well, first I'll say that I'm happy to hear that you are actually considering doing an effort on a national level. I think to have a national action plan and a council that follows that action plan by following suicide methods and risk groups, that will be a very important issue. And then regarding your question, I think that what is needed for people who are suicidal is to get help for their situation. And the evidence-based methods for that is cognitive behavioral therapy and dialectic behavioral therapy. So I think psychologists who are targeting or who have the people at risk for suicide as their target group, they should be able to provide that kind of service. So I strongly recommend that. There's also training programs for psychologists and psychiatrists, and I don't know if the general practitioners also could be part of that, but to master the most evidence-based efforts. I think also assertive community treatment, there's been trials in Japan where they've proven that it is effective to follow up on people after a suicide attempt. So with regard to this, with the universal, selective and indicated prevention, it's difficult to choose because I think in Denmark, the universal prevention where we restricted access to the most dangerous methods, that had a huge impact. When we took away the dangerous drugs used as sleeping pills, and when we removed carbon monoxide from household gas, it saved a lot of lives. So if you have, but of course you need to know your landscape. If you have a possibility for a structural intervention where you can remove something that's used very often and with a high case fatality, that's an excellent initiative. But also on the two other levels, there are very many initiatives that are very relevant. For the selective group, it could be people who are recently discharged from a psychiatric admission. They have an incredible high suicide rate, at least in Denmark, but I think it is a finding all over the world. So to be aware of that group and maybe make sure that you follow up early after discharge, that could be an issue as well. Now I use the time to answer many more questions than you asked me, but I hope you got an answer for your question as well regarding what the role of psychologists. But thank you.
예, 뭐 회장님이 궁금해하시는 것에 대해서 아주 더 많이 하셨지만 뭐 그래도.
So, she covered the general answers, and I think there are many things we can learn from her. That also, yes, Korea is doing evidence-based approaches, but we are lacking the system and also the credentials. Thank you very much for your answer. Excuse me. So psychiatrists are working hard, then the nationals, the public will encourage them to do so. And especially the professors have actively involving in enhancing the grounds for enhancing the psychiatric systems, and the professors have focused on clinical tests. However, I look forward to professors and especially the chairman Professor Chang to do more work. And there are many researches showing that there are tools that we can control some suicidal attempts. So there are many things that psychiatrists have to work harder. And we are happy to learn from Denmark. We have shared great ideas. And after learning from each other, that I have come to realization that, of course, we need to lower the suicidal rate. However, that the suicide is kind of the result of the social issue. So we have to use this as a means to enhance the societal network. Korea is known for ICT advancement, right? And if you buy something online, then you get a push message. I mean, the shopping, it's very easy. Online shopping is very easy, and then you get customized offers. Then we have everything ready in terms of technology. So we have to use this technology and then make sure that this technology is adapted in preventing suicide. Of course, Director Seo cannot do everything, but Director Seo, can you please mention on this kind of technological adoption? Right. Chairman Key and also Professor Pak mentioned about the technological issues, but we have the system ready. So the people who have psychiatric issues have their data stored in the system. However, for us to expand the services, the individuals need to agree. So this is more about legislation issues, as Head Mr. Pak mentioned, that this is something that we need to get agree from the public. But recently we are seeing that the public is more concerned about the personal information use. So before we talk about the technological adoption, that I'd like to go back to the high-risk people. I told you earlier about the people who attempted suicide again. They are in one category, but if they deny to get more services, then we can't go any further. So one of the projects is taking care of suicidal attempters, and when they are sent to an emergency room, only among those suicidal attempters, 50% have received that they are going to get follow-up services. I mean, the follow-up services have been very effective, but only half of them have agreed to get more services, follow-up services. So although we want to do preemptively, it would be nice if we can reach them. However, as we do have risky people already, we need to change the law to make sure that without their consent, the government can make intervention and stop them from committing suicide. So this is more like legal issues. I hope that the government and the National Assembly continue discussions, because this is something that we need to do in terms of legislation. So please continue to show your support on updating the, revising the legislation. And for the note made by Professor Yang, right, we need to expand the grounds for supporting the public. But I want to make sure that you know that under Prime Minister, we do have an organization. However, the organizations should be more dispersed into the community. At the moment, we have about 2.5 people in each community. Only 2.5 professionals are working in the community to take care of risky people, and then literally they are dealing with all the people who have tried suicidal attempts. So we're working hard to get more budget, but it's not working well. But I'll continue to work to get more budget and to allocate more professionals in each community. Right, and you mentioned about the budget. Yes, budget is important and we need to develop more programs. But the things we need to remember here is that please don't compare A to A from here and Japan or other countries, because we have different budget systems. We have a budget for the high-risk people. However, some of other countries, when they talk about their budget, the budget is not literally comparing that to high-risk people. So depending on the boundaries that you might see, our budget is bigger or smaller. So please be careful in comparing apple to apple in terms of budget. And the chairman of Korean Psychology Association, Professor Chang, mentioned about consultation. I know that many people are going through Corona blues, and and then we have a hotline, life line 1393, and so far the consultation has been under the Health and Welfare Services. Of course, preventing suicide is important, but when we consult people, they often talk about economic difficulties, not alone the suicidal issues. So we cannot say this lifeline is for psychological issues only, because the suicidal issues are closely linked with other issues. So that is why we have this hotline into bigger category of organization to provide more services for health and welfare related issues. But we have a dramatic surge of call numbers, and due to COVID-19, as of August, that we have received more than 10,000 cases, 10,000 calls. So our lifeline number 1393 is not enough. That is why we have introduced other programs as well. So it's critical to increase the number of consultants, and I look forward to your support, especially from the Korean Psychology Association. But yes, national governmental tools are important, but we have existing tools who have been involved in these issues professionally, like the Call of Love and some similar lifeline numbers. We have been pointed out about the issues caused by the 1393, and we're working on to improve our services.
간단하게 이제 시간이 별로 없습니다.
Because we do not have enough time, so please make it brief. With no regard to health insurance, the problem is that we have some services for suicide prevention, but the people who provide those services are not licensed. That is because of a lack of enough budget. And despite the fact that vulnerable people are entitled to getting such services, but they are not actually using them. And I think this is attributable to the lack of budgets. It is, yes, important to hire experts for suicide prevention, but we have psychologists or psychiatric doctors, so we can use the existing infrastructure or existing human resources such as doctors. So yes, it is important to provide welfare services, but what is missing is that we need to focus on mental diseases as well. So I will do more. I will make more efforts on that regard as well. Yes, we have still professors from Denmark. Dr. Thomas, this question goes to you. In terms of suicide prevention, doctors who are working for primary health care agencies or healthcare organizations, I think they are at the forefront of identifying some risks or some signs of committing suicide of people. So based on your experiences of clinical trials, what kind of signs, some initial signs, are the most important or critical things for patients? So among patients who show some signs, what signs do you think are the most critical cues?
Thank you. Yes, I've listened to your discussion, and I find it's very interesting to learn about your problems with suicidal attempts. But here I will allocate again the professor that visited us here in Denmark, and as it said, we take care of almost everything here in general practice. Also the people with milder depression, schizophrenia, and also the severe depressions. And of course we have a good relation with Merete Nordentoft at the hospital, so we know where to find her. So all our organization here is in Denmark has been for as we said 2 decades. It's actually very simple, and it's so important that the access to help is very easy to get. So, and actually our system here in Denmark with the general practitioners actually very cheap. So if you feel tempted, you can come and see the costs to build this system. Actually, a consultation here at the GP is about the tenth of the cost of a specialist at the hospital or specialist clinic. So that's just to take it to your consider. As you asked me, it's about we have where people call us every day. We don't know what we're going to see. We see about 30 patients every day, and about 20% is psychological or psychiatric problems, milder depression, and we have screening systems. We also provide like a psycho-education. We have special courses we can go to, so we can upgrade our education for all the way as long as we work. And so I maybe missed a question, but I think the main issue is that we are the filter for the specialists. So the people that feel sick comes to the family doctors, and we have all the tools to find the sick people and whom we're going to admit to the hospital. We can get help immediately, and so I think our system is safe and it's simple. So my suggestion is keep it simple. So that's it.
Well, but I wanted to ask you personal experience. But you more mentioned about the primary care, right? You mentioned that about 20% of the patients are experiencing mild symptoms, and that they are comfortable to come to you, and also the consultations are cheap, and also you have great tools to screen them out. So the advanced public system shows that the GPs are working, and they are contributing greatly in reducing the suicide rates. Okay, very good. Now I'd like to come to the end of the discussion. Before we close, then I'd like to give you 2 or 3 minutes. Please wrap up your last remarks. And I'd like to ask Professor Peg. I'll give you 2 or 3 minutes. When I went to New York, when one person committed suicide, all the related government officials, especially the city, come together, and then they discuss about the ways how to improve the society. I was surprised to learn that the suicide serves as an opportunity to make the society better. And in this process, the willingness and determination of leader is highly important. The leader needs to continue to pay attention to this issue and coordinate with related parties together. Then that will give hope to the public who are suffering from the COVID-19. Next.
Yes, I talked about the government previously. Suicide is a matter that the government cannot address by itself, because we have municipalities all across the nation. We have organizations, human resources for different regions. So the effort to reduce suicide in that particular region should be done by municipal officials in that region. So suicide should not be handled only by the government. So because we are witnessing suicide cases in our neighborhood. So religious organizations, all communities, networks, and all people have to be interested, and all people have to be cautious about this matter, and all have to pay attention to this matter so that people can acknowledge that this is a social problem. Yes, so suicide is not a problem that should be solved just by the government, but by the entire society. Yes, community index was Korea ranked 54th when it comes to community index. So rather than just reducing the number of cases, suicide cases, I think we also have to focus on making a better lives for people, so that they could live healthier lives. Compared to the average of OECD member countries, South Korea is lagging behind. So social workers, psychologists, and nurses, so we need more of these experts so that they could work on preventing suicide by collaborating each other. So they have to collaborate together in areas where they can do their jobs the most better, and I think that would help improving the mental conditions of people. Now people are doing a good job of preventing further expansion of COVID-19, so I am certain that people will do a good job in preventing suicide as well. Of course, through the government policies or related agencies, we have been discussing this issue proactively. So based on this discussion, each individual has to think about how to care for their own mental conditions. So, for example, taking a walk or calling to their friends to say hi to each other. So that would be a good example. Yes, proactive, creative, and new methods are important, but at the same time, it is also important to make the best or most use of the existing methods as well. Suicide cases, alcohol, chronic physical and mental diseases, and spoiled children cases. All those problems are well-known social problems. And we have to think about the effort that we have made to address those issues have been contributing to preventing suicide or not. And we also have to pay attention to women cases, and by taking this crisis as an opportunity to use IT technology or other creative methods to prevent suicide. Suicide is a problem for the entire community, and we have to keep that fact in mind. So preventing suicide would serve as a stepping stone for each country to go on to the next level. And especially I would like to say thank you to Danish doctors.
Your participation in this conference. Thank you so much. Thank you.
Thank you very much. Thank you.
예, 두 분께 감사드리고 또
Yes, and also the Citizens Coalition for Safety and Life Insurance Philanthropy Foundation and other lawmakers from the Korean National Assembly, and all presenters and all discussants who are here with us on the stage, and also people who are joining us remotely. So who are watching YouTube live streaming, I would like to express my sincere gratitude to all of you. So this wraps up all sessions. Thank you so much. Yes, thank you, President. And so my thanks go to Ki-sun Wan and President Chang Eun-jin and Director Seo Il-hwan, Professor Baek Jong-woo and Professor Yang Do-seok, and Dr. Kristen Morgan, Dr. Daniel Weidenberg, Professor Merte Nordentorft, and also Professor Thomas Saxild and Professor Baek Jong-woo. Thank you all. This concludes the third International Seminar on Suicide Prevention Forum of the National Assembly. Thank you so much, everyone.